Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you. Well, let's see. What city do you live in?
Jupiter.
No, you didn't put it down.
Oh, I'm sorry.
And your zip?
33469.
Yeah, we got it. Signed right here. That's it. What do you think, you were a doctor?
No, just signed too many paychecks.
Too many paychecks.
And you start signing 500 a week.
You have a
The
business?
signature disappears, yeah, several. Over the years, it just got smaller and smaller.
And you have a trouble with your left shoulder, right?
Yes.
How long has it been bothering you?
I'm off 15 years.
You had it treated?
Several different ways. Nothing that lasted.
Wow, what an intense ring. I can.
It's got to be an important call.
Sounds like a Mission Impossible moment, you know what I mean?
What kind of treatments did you have on it?
Started with physical therapy, Vioxx, once or twice some cortisone, mostly physical therapy, just years of working with it. They did an MRI, they couldn't see anything wrong, the bursa was 3 times the size of normal.
All right, where is this pain at? Right there? And
Well, I can't get up higher than that, and then the pain is from here to here.
Can you lay on
Only for a little while, and then I
Which,
have to roll over, and I'm a side sleeper, so that really screwed up my sleep.
it?
It's made me lose most of the muscle in that arm because I baby it too much.
Does your arm bother you?
Well, if I try and lift over my head, it bothers me. Yeah.
That's your shoulder, though. The arm's down here.
Well, it
Goes right there?
extends through there, yeah.
Does your neck hurt?
No. I do have a herniated disc in my neck, but they discovered that when they did the MRIs, but it's never bothered anything.
Oh, so you don't feel it?
No.
All right. How did you get this?
Probably a car accident
Oh,
many years ago.
Okay, let's see. Just drop it in my hand. Just drop it. Yeah. Hold it right here. Okay. The only part that's normal, that one.
Yeah, I mean, strength-wise like this is okay, but it's anything elevated or backwards that
You have 2 aspects of this joint that's bothering you, and one is in the front.
Okay, let me tell you one other thing. A year or so ago, I was gonna get shoulder surgery. I had an MRI, and he says there's a little bone coming down, and then he killed himself a week before I was supposed to have the surgery. Yeah, he had cancer and didn't want to deal with it.
Wow.
But I just figured I should tell you that. You were saying there's 2 aspects.
Front and the back. So it's 2 shots. We can do the back here, and then we'll do the front over there on the fluoroscope. So we actually look at the scar tissue there. Shot. Okay, take the shirt off.
Fine.
Okay, take your elbow with this hand
Take my elbow.
and pull it up there. There you go. You love that, don't you?
Oh.
So what kind of business do you have? You have all those employees? What? I'm trying to get you to talk so you don't have to think about this. Okay, let's go back. Both lungs, young guy, I mean, really in his 40s, and he went out to the desert in Texas and shot himself.
Wow.
Well, they have an insight, they know they don't want to put up with
Okay,
it.
so he was a doctor and he shot himself. That was the same thing my doctor did. I could not understand that if I'm a doctor, if I'm getting this new morphine and going out peacefully.
Yeah, well, that's true.
So I didn't get
I
the
would
doctor
not,
shooting
I would not
themselves.
pick that. It's too disfiguring, what does it do to the family? And I think that's it right there.
That's right, I did kind of shut the music off. Should put it back on.
And one for you.
Okay.
The words are, suddenly you wake up and you're in love. Remember that one?
That sounds very familiar.
You can scream, but not a lot. Oh. There you go. Done? You did good. You did fantastic.
Well, that's the needle in here too,
Yeah,
right?
that's the Since we're, usually I don't have to
Yeah, I
check
know.
myself, but since we're on film all the time, I do. Okay,
One question,
you're done.
what is it?
What is it? Look at this.
No, what is it that you put in?
Oh, anti-inflammatory. Take a drawing. That's it. You want to take a picture of that?
No.
This is the needle into the scar tissue. Actually, it's the other way around. There's a syringe in it.
Is this like the top of the shoulder?
Yeah, that's this bone here. In fact, you're going to do fine right now. Just lift your arm up straight. There you go.
A lot better than it was.
Just touch your
half
ass.
an hour
Go
ago.
this way.
Well,
That's almost normal,
well,
and that will improve right now.
okay, good.
So that's how you check yourself, and if you want to come back
Check,
to
check, check.
another shot. This front was fantastic. Did you see that? Went straight up.
Can you come in the room and do that, please? Because I have the mic.
On his original exam, he can only go this far.
Yeah, that was,
And now, go ahead. Now all the way up.
yeah, that's,
How fast do you want it, Scott? How fast do you want it?
that was fast.
That's pretty fast.
Is it gonna get better than that?
It improves, yeah.
Very cool.
I told you.
So sign in?
Sure.
Two back surgeries. Oh, my goodness. What can I do for you?
Well, doctor, I have a very bad, but the pain on my back is not really bad, but it's the legs that are killing me. The legs, they feel like I have a 50-pound bag of cement on each leg when I walk.
Front side or back?
They're just
Above the
heavy.
knee or below the knee?
Before used to be just heavy, now they start from here down. It seems like probably it's getting worse. And before, at least I could sleep at night. Now, at night I cannot even sleep an hour, and they wake me up because they're like crampy, and I cannot even lift them. Just like now, I go to move like this here. I have a hard time moving, and right now they're really painful, and they feel like even, something biting you or something like that.
In the calf? Both calves? Or which is worse?
Mostly, yeah, the calf, mostly the legs this year.
Which one's worse?
Well, the worst part that, like I said before, I used to sit down and get up very quick. Now I have a hard time even sitting down and getting up. And like mostly it's my leg. I know it's getting really worse because I have a really hard time walking.
The walking is better?
Before, a little while ago, I used to walk every morning about a mile. Now I tried and I cannot even walk like from here to the parking lot.
And how long has this been going on?
Well, probably the first surgery maybe it was 12 years ago, Marisa, something like that. The first surgery.
20 years ago.
Huh?
But 20.
20?
Yeah.
That long now, yeah. Well,
Time.
about 20 years ago.
Okay, you had two surgeries?
Yes, and the second was about 15 years ago.
Yeah.
When was the second?
About 15 years ago.
15?
Yeah.
So you had one 12 and one is 15?
20,
Oh, 20?
yes, and 15.
15.
But it was just like to free his nerve.
They told me that they wanted to free the
It
nerve.
was a minor surgery.
And maybe a few years back, I had an MRI done, and they told me that I have a lot of stenosis on my back.
Okay.
But my biggest problem, it's my legs. Like now, I'm standing here since this year. Now, this year, they feel like a piece of wood. Very heavy, very...
Piece of wood? What is a piece of wood?
Well, like numb, doctor,
Numb?
like...
It's a strange feeling. Eh?
Yeah, it's strange. Like I go like this here, and they feel like...
Your toes tingle? Toes.
Toes? No,
How about the top of your foot?
no,
How about the underneath the foot?
no.
All right. You have trouble climbing steps?
Not really. I go up the steps, if it was for the heaviness and low pain, I climb the steps and I go down the steps very easy.
Oh, so going up and down is okay.
The thing it's mostly, it's the heaviness and the numbness. A lot of time when I sit down and then I get up, I feel like wobbly because the legs, like I say, don't feel right, and I feel like if I'm drunk. But then after a few steps, I feel okay. But right now, I'm sitting there and all this here, it's all not all sore.
Maybe on the side.
No, it's strange, doctor. It's not really on the side. It's if you touch like this here, it's the whole.
Is it the front?
Yeah, it's the whole leg. You know what I mean? The whole
No,
thing.
not the whole leg. Front, side, or back?
Well, mostly the front.
That's your mostly calf, not the thigh.
Yeah, not this too much.
Okay.
Mostly this
All
here.
right. All right, I got it. Pretty nice. I'm going to rotate your hip here. What?
Hurts.
Well, we found something already.
It's very pain.
Oh, you got hip problems there. All right, so far you have the side and the inside here. Well,
Be fixed.
all right, stand right here. Face this wall.
See now when I move like this here, it's like like if I'm a robot, you know?
Yeah. Bring this up. Nice color shirt. Hold that up. And then go ahead and bend forward now. We're looking for a pain up here, so if you got a pain, put your finger on it.
No.
No pain. Come back up.
He kept his legs straight
Come
too.
back up. Bend back. Come on. Back up. Up, up. Bend back towards me.
Ah,
What?
it's right on my calves now,
What?
right? This
Right
here?
on the calf now.
Yeah.
And bend left.
Up.
And right.
Ah, right down to the
Right
right.
alongside
Yeah,
or back?
mostly in the leg here.
Well, you have a combination of things. I don't know. Now, going backwards, which side hurt? Both of them?
You mean when I,
Backwards.
it pushed right down here, all this here.
Down the back of the calf.
Mostly the calf.
It's the back though, not the side.
Yeah, yeah.
See, the location of the symptom tells you where it is. If you can't get that, then you can't find out where it's coming from. See, so we question you very closely. Not that we don't believe you, we just have to know something in my mind where it is. All right, so. You have a couple hip problems, but you have a back problem too. The back problem isn't all that bad. It's just scar tissue right in here. And that gives you that referred pain. You just want to make sure I'm alive, that's all.
Oh, that's
Who's that, your
wonderful.
son? It's very nice of him.
Yeah, he calls me every day.
Good, that's wonderful.
Okay, so you have hip problems and you have back problems. And that's why you're doing so bad. I think the referred pain though, from the back goes to the calf. So we can fix that, no problem at all. All right.
Well, mostly if I could just, can have like a little, the legs, feel a little better the legs,
Yeah, I get it. It's too bad, his insurance doesn't pay for him. Why? I have no idea. This is the top of the line stuff. That company, you ought to fire them. What good are they?
Yeah.
You can't get treated where you need to get treated. I mean, who are they to tell you what to do? Big man like you, Perugino, you gotta get it. Come with me. The left hip is the worst. It's right here.
The right hip?
Yeah, you see that you don't have a space. See the space?
Uh-huh.
You don't, it's the left. It's the left. And you don't have a space. But it's scar tissue over it, so we can put a shot in it and open it up like that.
Okay.
Do that. And now your back pain is, or your legs are coming from here. And I think maybe the left one too. One up, L45. Anyway, these work together, so you could have it the worst on the right because it works like this, not even.
Okay.
And so you got a lot of work here. You might want to get Medicare for this. All right, so what do you want to lose first? Do you want to walk better or do you want your leg pain better?
The leg pain, it's this here, doctor, is that right?
This one.
And you need a shot to,
2 shots.
2 shots. And, well, just because I gotta pay myself, what would be the cost?
Well, you're talking about, I don't even know, what do we charge for these? I mean, you wouldn't know either.
For the back,
Yeah.
$450.
$450. $450.
Yeah, because you quoted me $500, so with the $500 I could get the shot and try to walk better, is that
Yeah,
right?
you're gonna get everything for that. And we're not gonna do the hip for that, but we're gonna do your back. You got 2 places in the back.
Okay.
So we're gonna do the lower one today. You're gonna come back and do the upper one. And that'll relieve most of your pain.
Okay, so with the $500, you're gonna take care of my legs.
We're gonna take care of your back. And legs.
That's why I'm trying to,
Negotiate.
that's too bad the insurance doesn't pay, otherwise,
Well, it's your fault. What do you buy that stuff for? You buy the right stuff and you don't have any fun. Can't stand that. Maybe they paid for everything else. Okay, stomach here, head up there, loosen up your belt.
That's the problem, is they do pay for everything.
Yeah, well, they're stuck.
Stomach up here?
Nobody wants to pay for backaches. Of course, we're not on their plan. Somebody's gotta get you.
You want the stool? Oh yeah, hard time, you got major hip.
He's an athlete, you can tell.
Yeah, he made it happen.
It's gonna work like magic, I hope. Fernando suffered a long time. Suffered a long time, right, Fernando?
Yeah, about
We should put ABBA in and play Fernando. Have it in my car.
I was thinking of that. Abba. Wow. Wow, he's got quite a deal there.
Yeah, he does.
Yeah, not too dark. Look at that 4 or 5 level. He kept talking about the calf.
Yeah.
All right. I don't know which one to do first. Maybe we'll do the 4 or 5 level.
Is that like rotated a little bit?
Hmm?
4-5, is that rotated? Or?
It's not rotated that much, a little bit. The right side's really scarred down.
Yeah. So 20 years ago he had it done, so 15.
Bench. Where the hell is he? It's deep. I'm not hitting bone here. Sorry. Okay. That's ground zero. Yes, Fernando, what's the problem?
I don't know what's the problem.
There, you lived through that. How about that?
Oh.
Don't move.
You're gonna make it, Fernando.
This goes to the side of your leg. See all this black? That's all inflammation. It's all calcium. The left side is better. But this, and then this is the one we're going to do next time. This goes to the back of your calf. This is the side of your calf. They were broken up for you.
Thank you, Doc. Check. How is your walk, Fernando? Is it a little better? Or?
Yes, Yes, I'm here. I'm here listening to all the laughter over there.
When he does.
Yeah, that's true. Yeah, it's been very much fun, you know.
Yeah,
Right now, I cannot really
feel. Or you can't tell.
You know, even before, my bending backwards, it's bad.
Absolutely.
But forward,
Oh, you had good
Yeah,
forward.
I throw,
We don't like anybody who's imagining
Doctor even
things,
told
you know.
me
We got
before when
concrete
he
science
said
here. We don't
when
mess
it
around
feels
with,
better, backwards
all
or
that meditation,
and
all
to
that's-
relax
that's
more.
fine.
Sometimes when I sit, I go like this here.
Right.
Because the disc, they say they
Open up. Yeah. Yeah. That makes sense.
That's what it is. We even meditate a lot. We don't get anywhere with it.
Make your check.
What do you think?
Right now, I still don't have too much relief yet.
Been backwards. Where don't you have? No, that's good. Very good. Did you get that?
Yeah.
Yeah. That's very good. You couldn't do anything before. And remember, you have two levels. The bottom one I showed you, we didn't do that one. You're going to come back for that.
Okay.
That goes at the back of your calf. When we inject, it goes to the side.
Okay.
We also did not do the hip. You know,
And-
you got all this stuff going on.
Okay.
What is your for the treatment? Well,
We're going to take care of the whole thing for 500.
okay.
What I really, if I could get a little relief. from-
Yes, you just come back in a couple of days and we're going to do.
Yeah,
the
you
other
tell
one.
me
Yeah,
when.
We can't do everything.
Sure.
In one day. Isn't that fair?
Yeah, you almost tore down the gasoline overhang that goes over the gas pump. That was crazy.
Some people were born that way.
That's true.
You can have a seat.
That is
Okay,
true.
let's see, we're, Lake Worth, you do,
It goes over the gas pump. That was crazy.
some people were born that way.
That's true.
You can have a seat.
That is
Okay,
true.
let's see, we're, Lake Worth, you do landscaping,
Yes, sir.
and you don't have any insurance?
Nope.
No?
It's not too much, not too much money for Obamacare. It's not too much, not making too much money for the Obamacare.
With Obamacare,
Yeah,
Yeah,
they
not,
should. Too much money.
no, not too much. A little,
You know, when the company pay me, it's a small money. So I'm not covered to the Obamacare, so that's it. I know how I should.
So you don't qualify for
Yeah.
Obamacare?
Yeah, I'm not qualified.
That's,
I don't know who it's supposed to help, it's supposed to help him, that's what it's
well, the
for.
thing is even if he had it, it wouldn't matter.
You know, it just shows you what kind of, what they sold the public. I mean, they've taken it, they're taxing the rich and not giving it to the poor that need it. And that's what they said, we're gonna give it to the poor. Oh, you gotta get rid of those socialists, you know, the Democrats, you gotta go. Okay, what do you want me to look at?
For pain, too much of pain, this.
Pain in the left hip?
Yes, sir.
How long has it been?
For, what's that?
4, 5,
4 years. Got a pain.
5
A
years.
year?
More, 4.
4 years?
Yeah.
Take a medicine and it's okay for another, it's too much pain.
And I got every day, every morning I drink to the Peoria Tylenol. You know, the Tylenol 500 each one. So I got drink 2 pills and gotta stop the pain. But when I go to sleep, and the pain coming up too. I can't move it, my leg.
Where does it go, in your leg?
And I go to specialty area
Right there, where else does it go?
and I go to down,
Down the
and
side?
now I gotta cross a little bit on this leg too.
How far down does it go?
That one?
Left. How far down the paint? Does it go to the
Oh,
calf?
I cover to here, all this area.
It doesn't pass the knee?
Yeah.
It does. It's in the calf.
Mm-hmm.
And does it bother you walking?
Yeah.
Walking? All the time?
All the time.
Dile que tú tuviste un accidente.
I got maybe 10, 12 years to go. I have the accident, and the guys gotta pushing me in the back and rolling my car, and then I have a 3 disc broken. No, it's a breast hernia, move a little bit like that. And I got that one. I go to the chiropractor, so that's fine. But the pain, this area, got too much pain.
Who's giving you shots? You getting shots too?
No.
Just
For the hip?
Just chiropractic.
Yeah, he says the chiropractor.
Oh, that's all. You didn't get any shots?
No.
Does your back hurt?
Little bit.
Okay. I got it.
Ow.
What?
That one too much pain, Ricky.
I'm going to rotate your hip here. Relax. Let me have it. That's good. Let's bring this knee straight up. Hold it there. Don't let me push it down. Hold it up. Hold it up. And this one? Does that hurt?
Yeah.
Every time I sit in this chair, what's bothering you is a tendon. It starts here and lifts your leg up.
Yeah.
Okay, it's one shot. Yeah, you want that? Okay, come with me.
You want him lying on his back?
Yeah.
On your back.
Right here, right?
Put your head there.
Put your head up there, look it up. No, look it up.
Look up at the ceiling.
It's this one here, right? Okay, bring this down. Okay, and we're gonna, the tendon is right here. Bring that up, hold this up. This goes very fast, very fast. And there it is. All right, here it is. All right. You gotta be on the phone. There you go. I think that's ground zero, don't you think? Saul, don't die on me. There you go. Get
That's
up.
it?
You say something?
Okay.
Okay. Saul understood that.
Uh-oh.
Uh-oh.
Done. The pain.
It's gone?
Yeah.
It took that long?
Wow.
Wow, that's great. I'm gonna get him when he's walking.
You like the moves?
What's it done?
Huh?
Can you show me your leg up again?
Yeah.
Cool. And no more.
Done.
That's great.
The pain. Thank you.
You're welcome. Have a great day.
Thank you.
Yeah, well, I can make one.
But it has to be on the same CD though. I mean, CD's big, you can't keep sending CDs. Okay, what's up?
Listen, I just had a B12 shot. There's no connection, right? Good.
What's it gonna do for you?
Well, I'm complaining that I'm tired.
Well, you gotta do some push-ups. Yeah, it revives you. It really does. I know. I'm an aged person myself, and that's why I have to do that.
Listen, I'm a lot more aged than you.
Yeah, but you can still do it. I tell you what, the best way is against the wall. Stand
Oh,
with
really?
it. Yeah, just go, here's the wall,
Yeah.
and the more you put your feet away from the wall, the more weight you're gonna do.
Oh, I can do that.
Yeah.
I'll do that.
You do 10, 12, 15 of those every day,
I'll do
and
that.
you will find yourself having more energy than you can deal with.
Terrific. I can do that.
I do that off
I
my
was
kitchen
thinking
sink.
of push-ups on the floor, and
You can do those if you
I can't do it.
you can work toward it, but this is easy to do.
Much easier.
All right.
All right.
That's good, what you're
Look at that
doing.
nice voice.
I told him he can sing.
Beautiful.
You even had some vibrato in there.
Yeah. Well, I study a lot, you know.
You did?
Yeah, whatever's out there, I have to know about.
Yeah, I got a karaoke machine and I wanted to do
Oh.
karaoke. We could do it here at the office. The
You know
singing
what
doctor.
trouble I have?
Why?
I can't remember the words.
I would have the lyrics written out. It's not a big deal.
Oh, this back is wonderful.
I'm glad you think
It's
so, but it
almost straight.
hurts.
It's almost straight. Look.
I can't tell you how much it hurts.
I can tell. I can tell.
Yeah, I mean, it doesn't have.
Here's the spine, and it goes straight down there.
That's true,
A
Doug.
little bit of
Oh,
crookedness right there. But see,
Also on the
you're doing
right.
so well, and you don't even know it.
but because it
There's
hurts
you
me.
right here.
And you,
And you know, yesterday, a girlfriend of mine was walking with me and she said to me, Maureen, you're so much straighter.
yeah, that's what I've been trying to tell you. You're so much straighter.
And I see it, but it hurts. It hurts here.
I got it. Maureen keeps trying to tell me where she's hurting. I'm telling her.
Listen, I'd rather take your word than mine.
Yeah, you have a lot of emotion in yours. I don't have any emotion. Okay, so where is it? Listen. It's a Beatle, no, it's a Bee Gees song. Bee
Oh,
Gees.
words.
That's right, yeah. Some of those weird things that they sing.
Yeah,
You know,
yeah.
what are they talking about? Especially the one who died.
Oh, the minor?
Ugh.
In
He
the
had
event
this
of
voice.
something happening
Yeah,
today,
that's right.
there is something I would like you all to see. It's just a photograph of someone that I knew.
Yeah, they really did well.
Two of them died, you know, pretty recently.
Yeah, the one with all the hair, he's losing his hair, but he's still alive.
He's still alive, but I mean, the one that could sing really high, Robin, I think his name.
Yeah, Robin.
He passed away, and then the keyboard
Then they had
player,
one with the hat,
he passed away.
because he was bald. He passed away in surgery, they operated.
Oh, I didn't know that.
It was a mistake.
Oh. And then, of course, they have their brother Andy that was going out with
Oh,
Victoria
yeah.
Principal. And
Yeah, Andy. I thought he was a decent singer.
yeah, yeah.
They had no room for him. I think he was a,
He wanted to be a soul act anyway.
he had a drug problem.
Yep. I think he hosted like the New American Bandstand or something as well. You know, when he was in his heyday.
Okay. Get your bench. You know, it's amazing how this Medicare works. They accepted everything we sent on you.
I
Okay?
know.
There was one that they looked at, they said, oh, we can't pay that. And I said, why can't you pay that? Because you did 2 of these in one day,
Oh, my God.
and you're not allowed to do 2 in one day. I said, well, pay for one. They won't pay for anything because it's a saving money deal. It's not,
That's what's really frustrating is that they, you know,
It's terrible.
they make it seem like because he's going to bill for 2 that they don't pay for 2, but they would pay for 1, but then they don't even pay for 1.
well, the rule says they could pay for one, but why don't they pay for one? See, I don't get this. That's why we need a senator or something who's influential to bat these people down because they're not treating the physicians with respect.
Nope.
And who's going to take care of these people?
Well, I told you I would try to
I
get in
know
touch
who'll
with
do
that
it.
senator.
Marie Suave. I finally got a name.
Marie Suave?
Suave. She's going to take care of you. Stay there.
Is that a real person? Or you just
That's a
kidding?
real person.
Marie Suave. You know, there used to be a song called Rico Suave.
Rico?
Yeah, it was the Spanish singer, and he'd say Rico Suave. And it was like a Spanish rap song. It was actually pretty good.
That's my friend here. Jeffrey Minks.
Rap, they should have. Gangster rap.
Oh, now we went up another one.
I know, we keep going up, but it
5,
keeps
4,
hurting
3,
here.
2, 1. T12L1.
We keep going up,
This is good. This is all straight now.
but it hurts.
I know, but it's still straighter. It's getting straight.
So what should we do? Keep doing
It's exactly what we're doing.
it, really?
Because the incremental improvement you're getting is unnoticeable by you. It's too small, but we notice it by looking
Right.
at it.
Okay, great. Now that's terrific.
Forty Fifth Street.
Oh, I'm off of Blue here in the city.
Oh, you're not near there, huh?
No,
All right, what do you want me to do for you today?
I've been having pain from my neck down my shoulder, on my total shoulder blade in the back on the right, and the pain goes all the way down. I've been having tingling in my fingertips,
Which one?
all of them. Like the tingling.
Thumb is worse.
I Actually, this one has been the worst.
That's what I'm asking you. Yeah, what is it, their tingle one?
Yes.
How long has this been?
It's been some months, maybe like around April.
Oh.
I've been going and getting tests at Cleveland Clinic, and they diagnosed me with a pinched nerve in my neck.
So what'd they do for it?
I got medication.
That's it?
Still got pain. I basically had medication, and they suggested I get therapy. So that's basically it, but I've been in so much pain. And I had a friend at work that recommended you.
Mhm.
She said that you had helped her.
So do you have any treatments at all?
No. Just pain medication so far.
All right. Well, how did you get this?
I don't know, it just started, I mean, recently. So I have no idea.
Well, from April, that's a long time.
I know, I've been going to them back and forth, going through the tests, and it's like nothing.
Maybe you didn't lift anything or fall or anything.
No,
Did you work?
yes.
What kind of work did you do?
I'm a supervisor. I actually, most of my work consists of me at the computer doing felony arrests, you know, sending them down to the courthouse.
Oh. Supervisor of records
Yes.
for the city.
Mhm.
Wow. Okay. So does this wake you up at night?
Yes, I can barely go to sleep first.
And you have no treatments, just the meds, huh?
You know, just the meds. You have a pen.
Which Cleveland Clinic did you go to?
It's off of Donald Ross Road.
Oh,
We went by there yesterday.
we saw that. Yeah. Okay, well, we can help you out, no
Well, I'm looking for help. I don't think they've done enough for me for the pain. It's just all the time.
They want repeat business.
I don't want to give them repeat business.
Okay, go ahead and put your chin straight down and tell me if that hurts anywhere. Hurts on the right. Chin all the way back now. Way back. You're not going back. Does that bother you?
Yeah.
On the right. And chin on your right shoulder. Mm. And the other way. That's much better, isn't it?
Oh yeah, left side's good.
Okay, this finger here comes from, it's a 5-6 right there, 6-7. This hurt, or is this hurt?
No.
It's gotta be right there, it's swelling right there. It's right here, isn't it?
Yes.
This does the arm, the back of the arm to this finger. Okay, stand right here. Now, your head goes to the left. Did you know that? That means this shoulder's down. So this is a secondary to this. You follow that?
Yeah.
And how about that right there?
It's starting to tingle more.
T3-4. This is where you're talking about that football player, baseball player that they cut his rib out. That's what you had. That's what he had, just the simple stuff.
Oh, wow. Cost him $11 million.
Yeah.
I don't want any cookies.
Okay, that's your bill, 10 million. Give me a discount.
Oh my God.
Come with me. All right, so she's got a curve right there. And I think that's all of it right there. So that makes her curve this way, so she's resting on the left, pulling on this ligament on the right. It's the whole thing. What they did to that guy, they took this rib out.
Oh, that's awful.
All he had was a curvature here. He probably went this way and put this rib up here. So they cut it out instead of knowing the physiology of how this stuff works. See, years ago, when I was going to do this for a living, I had to figure out the physiology of pain production. It's a concept that you don't go with an MRI. You have to examine somebody, find out where that pain is, and then figure out why it's there.
Right.
And then fix it. That's what we've been doing, and it works. Okay, Janie.
I'm glad I was recording that.
Don't be afraid. We won't bite. Not here. We'll bite later. You have a curvature here between your shoulder blades. This is a little one. It makes your neck go concave to the left. And you're pulling on this ligament right here where that thing is. You can't see it, but it's right under there. It looks like this. And you see that bone formation there?
Yes.
That's because you're leaning on the left all the time.
Yeah,
Yeah, you're pulling on the right. So we can fix this, not a problem. We have to fix this too, though. We got to get this curve out of here. You can see where it's rotated. See, short, long.
okay.
So that's T2. So these are all shots that we're talking about.
Okay.
Are you saying yes?
Yes, I need the pain to just.
Still with it. You can just pick.
Just when you thought it was,
Just when you thought it was over, now we have to lay down,
we're just getting started.
lay down on your right side, face the wall, and we're gonna do two sides.
Right side, face the wall.
That wasn't so bad though, right? We had that already.
Yeah, just move down. There you go, just like that. And pull this up. That's the one we're after right there, I think. All right, just turn you right on over. Turn, you remember that song? Turn her over. That's all I remember.
That's that.
Put your arm down, head down. Just like, no. Side, that's it. This is the important side. The other side was secondary. It's right there. Feel that?
Mm-hmm.
There you go.
That was fast.
So I mean, you would have felt dizzy right then.
Usually my medication works better on the empty stomach for me, so we'll see.
Can you move your neck like to where, before when you have more range of
Yeah, no
motion?
more.
That's what you're gonna see, more range of motion and less pain, or no pain. The tingling still there.
Starting to go away some.
Well, the first injection has to create movement. And when it does completely move, the medicine stays in you for 8.5 to 9 hours, and then it's gone. It's out of your body.
Okay.
So,
I've been going to other doctors for months and months. We just
no way.
started at that painful part first
So you're getting a little bit of relief
on the shoulder.
on your shoulder. Well, I mean, the more the minutes go by, the more relief you get.
I'm looking for
Yes, you are.
I'm looking for a real good day.
When I,
It's going down my ward.
And how are you?
I'm good. It started at my shoulder. That's mainly where it was burning the most. So I think it'll start, you know.
Put your chin on that. That's an improvement. Yeah, your hand tingle's gone?
I can feel it going away some.
Yeah, it's gonna be gone. We don't wanna see you, what's today?
Monday,
Monday.
When's your next time you can come in? Tuesday? Well, you're the boss. Wednesday?
Wednesday I can come back.
Wednesday, because we want to check you over.
Okay,
Make sure you did all right. I think you're cured today. But,
okay. Wednesday, same time?
yeah, Wednesday, 9 o'clock.